Joining us via Skype is the former chairman, the Nigerian Economic Summit Group, Bukar Kyari. Thank you for joining us on the news.
You're welcome.
All right, so you must have heard the news of the northern states opting out of imposing any kind of lockdown. What version of this did you hear, and what might be the reason for it?
Well, the disturbing fact is that the Northern Governors Forum made a statement some days ago in terms of not fully participating in the lockdown. But since then, a lot of things have changed. Of course, the very first governor that actually announced lockdown was Kaduna State, even before they had a single case in the state. And obviously, Kano had been denying until it hit them hard. So right now, I believe there are cases in at least 7 or 8 northern states. And this is something that one cannot bury one's head in the sun and wish things away. One has to prepare for it. In addition to that, as anybody in Nigeria knows, the Human Development Index for the country as a whole is amongst the lowest in the world. 2, poverty in Nigeria is one of the most prolific location for poverty in the country is the northern parts. Lower level of human development, and all of those actually exacerbate the situation. So prevention is better than cure, and so taking steps very early on is crucial in at least, if nothing else, mitigating the oncoming pandemic in that part of the country.
Does all of this not send out a wrong signal at a time when we are looking for a united front against this deadly, not potentially, but deadly pandemic in this country?
Indeed, social distancing, washing of hands, and all the things that NCDC has been advocating for, the presidential task force on every day that they address the nation, indicate the basic things that need to happen. And in addition to that, some state governors, particularly the one in Lagos, have been coming out on a daily basis, educating and raising awareness of people and encouraging those things. And, number one, Nigeria's healthcare system in general is among the weakest in the world. It's, if not at the bottom, 20% of the world. Africa as a whole is going to face this we are in a precarious situation when it comes to healthcare delivery system. And within Nigeria, northern Nigeria is at a higher disadvantage than the rest of the country. So we should, in northern Nigeria, the leaders, the governors need to actually bring in the traditional rulers, the religious leaders, in raising awareness of this pandemic and sensitize the general population of what can encourage transmission, what are the things that one needs to do to mitigate the pandemic, because it is here. It's here, and the deadly thing about this disease is that a good percentage of people are asymptomatic, meaning that they do not show any signs of illness. And that is very deadly, because it means that people that are walking and doing things normally are actually not healthy enough. And therefore, one has to be extremely cautious. You have to behave as if you carry it. And when you meet somebody, you should also assume that that person is a carrier as well. So it's a double whammy in a sense, really.
All right, let's look at the long-term challenges and possible solutions. There's been this repeated statement, you even alluded to it, that the North has a weak healthcare system. What is truly responsible for this? And how, in the short and long term, can the government begin to make an effort to address this?
Well, in the short term, we need to actually scramble and invest very heavily in buying equipment, PPEs, masks, and so on and so forth for the frontline healthcare workers, as well as equip order the medications, the test kits, the laboratories that are needed to conduct tests. For example, in the north, up until the one in Kano was open, there was not a single test laboratory in the north, except for bringing everything down to Abuja. Now, if there are, if the rest of the laboratories that have been planned are open and it is dealt with, the other secret to this pandemic is testing. And so if more of these centers are opened and equipped, then we would be in a position to know where we stand vis-a-vis the total number of infected people and even the rate of infection going on. Right now, we're kind of flying blind, and as such, even the numbers we are reporting may be grossly understated. I hope we are doing enough tests in the country to actually cater for some of the numbers we see, because it is still very early with less than 500 people confirmed cases in the entire country. Of course, in the north, outside of FCT, Kano is becoming a hotspot, so to speak. And the index case that brought the COVID-19 to Kano, it was just one person, and now there are, I believe, double-digit confirmed cases in Kano alone. Okay,
let's take a step away from the north for a second and look at a general state-by-state method of addressing concerns when it comes to the COVID-19. Is this a good thing? Does it have drawbacks, such as presenting a weak link where the prevention policies are not robust enough from these states and counters the work that the federal government is doing?
The most important thing actually to do is to do it on a unified front, because if there is any difference in terms of the strategy on mitigating this pandemic, will basically make the weakest link would basically be where the chain will break. So what we need to do as a nation is to have a concerted, unified strategy for the whole country. Of course, someone will argue that, well, since we do not have it in our state, we should be allowed to move around. And in all honesty, that's not what it is. It may be that they have it, we just don't know that they have it. Because Nigerians are extremely mobile people. Up until the airports were closed, on any given day, hundreds of thousands of people move from state to state and by road naturally. So you cannot block the movement of people. And therefore, if there is just one person moving from one state, a hotbed state, say Lagos, going to Kano or going to Borno State, will basically become a carrier that might go and infect. So if we are going to attack this situation, or if we are going to fight this war, it has to be done on a national basis. And the strategy of the presidential task force should actually be national in nature, national in outlook, and possibly even encourage the presidency to involve all the governors. There should be at least a briefing sessions with the governors on a periodic basis by the presidential task force, so that everybody is aware, everybody is doing their bit in terms of raising the awareness, because this is a disease that if enough information is given and people are encouraged to behave a certain way, we could mitigate it, we could reduce the spread until such a time when a vaccine is discovered.
All right, just before we let you go this morning, I would like to take your thought on the issue of balancing playing politics and providing effective leadership at this time of crisis.
This is not a time for politics or political games. This is clearly a time when the nation needs to rally around the leadership. And also the leadership should be open enough to listen to what people are saying in terms of giving them the that actually help us and move ahead.
All right. Thank you so much for joining us on the news.